Myocardial infarction, commonly known as a heart attack, is a serious medical emergency. It is one of the leading causes of death worldwide, affecting millions of people each year. Understanding what happens during a myocardial infarction can help in recognizing the symptoms early and seeking prompt medical attention, which can be life-saving. It occurs when blood flow to a part of the heart muscle is blocked. This blockage can happen suddenly and without warning, leading to severe consequences if not treated immediately. The heart muscle relies on a constant supply of oxygen-rich blood to function properly. This blockage is usually caused by a blood clot forming in a coronary artery, one of the blood vessels that supply the heart with oxygen-rich blood. These clots often form due to the rupture of a plaque, which is a buildup of fatty deposits, cholesterol, and other substances on the artery walls. Without a steady supply of oxygen, the affected heart muscle begins to die. The longer the heart muscle is deprived of oxygen, the greater the damage. This can lead to complications such as heart failure, arrhythmias, and even death if not treated promptly. Imagine a busy city center with traffic flowing smoothly. The roads represent the arteries, and the cars represent the blood cells carrying oxygen and nutrients to various parts of the city, which in this analogy, is the heart. Suddenly, a major road is blocked. This blockage is akin to a blood clot in the coronary artery. Just as the roadblock prevents cars from reaching their destinations, the blood clot prevents oxygen-rich blood from reaching the heart muscle. Cars cannot get through, causing a standstill. Similarly, the blockage in the artery causes a halt in the blood flow, leading to the deprivation of oxygen to the heart muscle. Similarly, a blocked artery prevents blood from reaching its destination, the heart muscle. This can cause severe pain, often described as a crushing or squeezing sensation in the chest, which may radiate to the arm, neck, or jaw. Just like the city traffic, the flow of blood to the heart is crucial for its proper functioning. Ensuring that the arteries remain clear and unobstructed is vital for maintaining heart health. Recognizing the signs of a myocardial infarction and seeking immediate medical help can make a significant difference in outcomes. The most common cause of this blockage is atherosclerosis, a gradual buildup of plaque inside the coronary arteries. Plaque is made up of cholesterol, fat, calcium, and other substances found in the blood. Over time, plaque hardens and narrows the arteries, restricting blood flow. Think of your arteries as pipes carrying water. If rust and debris accumulate inside the pipes, the water flow will be reduced. Similarly, plaque buildup in your arteries obstructs blood flow, increasing the risk of a heart attack. Recognizing the symptoms of a heart attack and seeking immediate medical attention is crucial. The most common symptom is chest pain, often described as a feeling of tightness, pressure, squeezing, or a heavy sensation in the chest. Other symptoms include shortness of breath, sweating, nausea, pain that radiates to the left arm, jaw, neck, or back, and lightheadedness. It's important to remember that not everyone experiences the same symptoms, and some individuals may have mild or even no symptoms at all. This is particularly true for women and people with diabetes. Time is of the essence when it comes to treating a heart attack. The sooner treatment is administered, the more heart muscle can be saved. The primary goal of treatment is to restore blood flow to the affected area of the heart as quickly as possible. Imagine a building on fire. The longer it takes for the fire department to arrive, the more damage the fire will cause. Similarly, the longer a heart attack goes untreated, the more damage it inflicts on the heart muscle. Section 5. Medications, dissolving clots and managing symptoms. Medications play a crucial role in treating heart attacks. You may receive aspirin, a blood thinner that helps prevent further clotting. Nitroglycerin is another common medication that helps to widen the blood vessels and improve blood flow. Other medications include clot-busting drugs that dissolve the blood clot, pain relievers to manage chest pain, antiplatelet agents to prevent further clot formation, and beta blockers to reduce the workload on the heart. Section 6. Surgical interventions, restoring blood flow. In some cases, surgical procedures may be necessary to restore blood flow to the heart. These procedures are often critical for patients suffering from severe coronary artery disease, where the arteries that supply blood to the heart muscle become narrowed or blocked. Without adequate blood flow, the heart muscle can become damaged, leading to heart attacks or other serious complications. Surgical interventions aim to restore this blood flow, ensuring that the heart receives the oxygen and nutrients it needs to function properly. One common procedure is angioplasty, also known as percutaneous coronary intervention or PCI. This minimally invasive procedure involves inserting a catheter with a balloon at its tip into the blocked artery. The catheter is carefully guided through the blood vessels to the site of the blockage. Once in place, the balloon is inflated to open the artery, allowing blood to flow more freely. This procedure can significantly improve blood flow and reduce symptoms such as chest pain and shortness of breath. In many cases, a stent, which is a small wire mesh tube, is implanted during the angioplasty procedure. The stent helps to keep the artery open, providing a scaffold that supports the arterial walls and prevents them from collapsing or becoming blocked again. Stents can be either bare metal or drug-eluting, which means they are coated with medication that helps to prevent the artery from becoming blocked again. This combination of balloon angioplasty and stent placement can be highly effective in restoring blood flow and improving heart function. Another important surgical intervention is coronary artery bypass grafting or KBG. This procedure is typically recommended for patients with multiple blocked arteries or those who are not good candidates for angioplasty. During KBG, a surgeon creates a detour around the blocked artery using a healthy blood vessel from another part of the patient's body, such as the leg, arm, or chest. This new pathway allows blood to bypass the blockage and reach the heart muscle, improving blood flow and reducing the risk of heart attacks. The grafted blood vessel is carefully attached to the coronary artery above and below the blockage, creating a new route for blood to flow. This procedure can be life-saving for patients with severe coronary artery disease, as it helps to restore adequate blood flow to the heart muscle, reducing symptoms and improving overall heart function. Both angioplasty and KBG are essential tools in the fight against heart disease, offering hope and improved quality of life for many patients. Section 7. The importance of early action. Time is muscle. The old adage time is money takes on a whole new meaning when it comes to heart attacks. In this case, time is muscle. Every minute that passes without treatment means more heart muscle is being damaged. Prompt medical attention can mean the difference between a full recovery and permanent heart damage or even death. Remember, even if you're not sure whether you're having a heart attack, it's always better to err on the side of caution and seek immediate medical attention. Section 8. Prevention is key reducing your risk. While a heart attack can be a frightening experience, the good news is that there are steps you can take to reduce your risk. Lifestyle modifications are crucial in preventing heart disease. Eating a healthy diet low in saturated and trans fats, exercising regularly, maintaining a healthy weight, quitting smoking, and managing stress all contribute to a healthier heart. By adopting these healthy habits, you can significantly reduce your risk of developing heart disease and experiencing a heart attack. Section 9. What to do when every second counts. Your action plan. Knowing what to do if you or someone around you experiences a heart attack can be life-saving. Heart attacks can strike suddenly and without warning, and every second counts. Immediate action can significantly increase the chances of survival and reduce the risk of long-term damage. First and foremost, call 999 or your local emergency number immediately. This is the most critical step, as professional medical help is essential. When you call, be prepared to provide the dispatcher with as much information as possible, including the person's symptoms, their location, and any known medical history. Stay on the line until the dispatcher tells you it's okay to hang up. Do not attempt to drive yourself to the hospital. Driving in such a state can be extremely dangerous, not only for you, but also for others on the road. Instead, wait for the ambulance, which is equipped with life-saving equipment and trained personnel who can begin treatment immediately upon arrival. While waiting for the ambulance, help the person sit down in a comfortable position and loosen any tight clothing. This can help ease their breathing and reduce the strain on their heart. If possible, have them sit on the floor with their knees bent and their back supported. This position can help improve blood flow and reduce the workload on the heart. If the person is conscious and able to take medication, offer them an aspirin unless they are allergic or have been advised by a doctor not to take aspirin. Aspirin can help by thinning the blood and reducing the severity of the heart attack. However, it's important to ensure that the person chews the aspirin rather than swallowing it whole, as this allows it to enter the bloodstream more quickly. Remember, Prompt action can make a world of difference in the outcome of a heart attack. Stay calm, act quickly, and follow these steps to provide the best possible care until professional help arrives. Your quick thinking and decisive actions can save a life.